It's really a privilege to have, such a renowned doctor amongst us, not only to, to educate us, but also to guide us in different ways. And therefore, I know that this talk of his will not only be interesting, but it will be educating to all of us. I once again, extend my sincere thanks to him on behalf of all of us as well as on behalf of our management. Thank you, sir, for coming over here.
Thank you so much.
Giving your talk. Thank you.
Thank you so much. इतनी पढ़ाई भी नहीं करनी है, ये तो करते गए. Anyways, let's start. What does ENDS stand for? I was told that the age group you all belong to is from 16 to 24. So, what does ENDS mean? Someone who can raise a finger and tell the full form of ENDS. E stands for electronic, N stands for nicotine, D stands for delivery, S stands for system. Yani that system which is going to deliver nicotine. We have, all of you know about cigarettes, tobacco. Okay, so what does tobacco contain? What does tobacco contain? Anyone can raise the hand and tell me. तंबाकू में क्या आता है, क्यों वो नशीला है? Anyone? कोई नहीं, पढ़ते नहीं हो? Do you watch a movie or not? आता है कि नहीं? Before any movie, smoking is injurious to health. You don't visit theaters, cinema halls? No. बच्चे बड़े पढ़ाकू हैं. I to go and watch. I had about, say, around 15-16 years of my education after I started my medical life. But I used to watch movies. I also topped my exams, but I used to watch movies. तुम लोग नहीं देखते movies? किसने देखा? Animal देखा कि नहीं देखा? नहीं देखा. कोई और movies देखी कि नहीं? कौन सी सैम बहादुर? नहीं देखी. इसके पहले बस पढ़ाई करते रहते हो. Okay, so coming to the point is that this tobacco that you chew or you smoke consists of nicotine. Nicotine, सुना है? Anyone heard about this? So nicotine, whenever you smoke or you chew, it goes into the body. When it goes into the body, it goes into liver. Liver में it undergoes metabolism. Whatever we eat gets digested and it gets excreted out either through urine or through stools. ठीक है? Nicotine will also undergo degradation. It will also undergo metabolism. तो वो that also gets digested. But problem क्या है nicotine का? Suppose if you eat chapati, you are eating roti. Roti will give you a lot of carbohydrates. It will give you energy. You eat a butter, it will give you energy. It is going to be used for your daily activity. You are going to run, you are going to work, you are going to study. So the energy that butter or for that matter carbs give is going to be utilized in the right way. Nicotine, when it gets metabolized, जब वो उसका पाचन होता है, when it gets digested, it releases what is called as nicotine associated nitrosamines. ये chemicals है. These chemicals are carcinogens. What are carcinogens? Anyone? Can anyone raise hand? आराम से गड़बड़ तो गड़बड़ यार, कोई प्रॉब्लम नहीं है. Please raise your hand. What is carcinogen? Carcinogens are the chemicals which cause cancer. So if you smoke or if you chew tobacco, it releases carcinogens, chemical substances which can cause cancer of ओरल कैविटी, मुंह का, आई एम स्मोकिंग, द फ्यूम्स जो निकलते हैं, धुएं जो निकलते हैं, आई एम गोइंग टू एब्जॉर्ब दैट, इट्स गोइंग टू गो टू लंग्स, causing a lung cancer. If you chew, it's going to cause mouth cancer, tongue cancer, cheek cancer. Have you seen photo? Kabhi, does anyone? Okay, no one will raise his hand. Does anyone smoke? I think I raised my hand. So the thing is, if you see the box, the pack of cigarette, that has got a picture. Up to 30 to 60% of the packet, the photo is showing a big cancer. देखा है कि नहीं? अच्छा, मूवी में देखा है कि नहीं? पहले आता है फेफड़ों में, they show the endoscopic picture, they show someone who's walking around. सुनीता ना कि सुनीला, कौन है वो? चलो मूवी तो देखते हो, कुछ तो बाहर निकला. So सुनीत जो भी है, so she was 25-30-year-old, she was chewing tobacco, she developed cancer and she died at a very early age, living behind a family of 2 kids. So this cancer can happen not only in the mouth, it can also lead to lung cancer, it can also lead to cancer of food pipe. Food pipe is a pipe which leads from the mouth to the stomach. तो ये जो cancer है, it leads from it can start from lips up to the stomach. It can go beyond into the bladder. Bladder क्या है? Bladder is urinary bladder. Okay? जहाँ से पेशाब निकलता है, वहाँ it stores, that is storage. So that storage, where the urine gets stored because of smoking, it can the cancer carcinogens get deposited. So not only it can lead to cancer, मैं तो cancer ही बोलूँगा because I'm a cancer specialist. But apart from cancer, tobacco, nicotine can lead to your stroke, paralysis, stroke, heart attack. It can lead to acidity. It can lead to stomach ache, stomach upset. It can lead to lot of other things. But predominantly paralysis. दिखाया है कि नहीं ऐसे गिर रहा है? कोई किसको खिला रहा है वहाँ से गिर रहा है? क्यों? Because your face has become weak because of paralysis, and because of which you are not able to eat. So not only it causes cancer, but it will also cause other problems. So tobacco not a good to eat. So what is ANDS? So I'll tell you what happens is, हमने बोला कि जो जलाते हैं सिगरेट, so when we heat it, it gets combusted. Combusted यानी वो it gets processed. Combustible substance जो होती है ना, that combustible substance can lead to these cancers. There are 65 graded carcinogens, cancer chemicals which can cause cancer in the smoke or in the tobacco. लेकिन चलो ये नहीं है. So the marketing guys came up with we want to use tobacco in some form or other form. So what would be the other form? I am going to not combust it. I am going to just heat it. Heat किया, the amount of nicotine which is utilized is much more, but cancer causing agents coming out of tobacco is less. So they said please use ANDS. Please, क्योंकि vapor निकलती है, they are just heating it, they are not combusting it. So vapor जो निकलता है, that's what's called vaping. It is also called as juuling. Juuling यानी क्या? Joule means a pod, a cylinder, जिसमें you put a lot of nicotine. So can you see the 1, 2, 3, 4? So number 3 and number 4. तो अलग से we get a pod or a cartridge which is filled with the nicotine. अब क्या होता है कि that nicotine is lighted with electricity. It is electrically driven. It is battery driven. Asmat, तो ले रहा है? लेता नहीं है ना? नहीं, अच्छा. So the thing is, what's your name? Rohit. So it is electricity driven, battery driven आती है. That will light up, that will heat up the nicotine. अब कितना nicotine use करना? So there are 2 different kind of nicotines available. एक में 12% nicotine है, which is a nicotine-based salt, and the other liquid-based nicotine, which has got 9%. People will start with 9% and go to 12%. So once this nicotine is lighted, it is charged up, it will release the fumes, the vapor, which you are going to inhale. So there is no other carcinogens apart from nicotine. So is that safe? No, because the studies have found that the chemicals which are released by the vaping, by juuling, are lesser in concentration, but they are equally dangerous. Because you will keep on using e-cigarettes more than what you keep on smoking. You are using tobacco. So, if you are smoking 20 cigarettes, because of nicotine, you are going to use this 50 times. So, the amount of chemical which builds up in your blood is good enough to cause cancer. So, e-cigarettes, vaping, juuling is not a right way of quitting tobacco. Now, why nicotine causes addiction? Anyone knows the idea? How does it act? अच्छा ये लोग जो फूकते हैं वो क्यों फूकते हैं? Pardon? Very nice. Clap for him. Clap for Rohit. Very nice. So क्या होता है कि when you are smoking, the nicotine goes into blood. This blood, nicotine in the blood now goes to brain, and brain में it will stimulate the release of dopamine. तो dopamine is a pleasure hormone. बड़ा आनंद आता है, बड़ा सुख मिलता है. You have to understand कि it is used for people when they think that it gives me mental relief. But actually, it is causing a physical stress. It is putting body to the stress, but it is causing mental relief. So you feel there's increase in concentration, attention. Someone will like to use it for increasing the work performance. Okay, but actually it is degenerating the brain. So in the long run, if you take tobacco, nicotine, which causes dopamine release, it will lead to loss of attention, loss of concentration, loss of memory, loss of an attention deficit. अब क्या हो रहा है कि यार मुझे मजे आ रहे हैं. I am taking nicotine in such a huge amount that I'm able to concentrate. No, let me take more. So one of the inherent ability of the body is that it wants more and more. The dopamine which is released will fit into the receptor. एक receptor होता है in the bodies. It fills into receptor. अब receptor क्या कह रहा है? ये दिल मांगे more. ये दिल मांगे more. So the idea is कि they will build up, body will start building more and more receptors. You want to get more and more nicotine. More and more nicotine meaning you are getting addicted. So nicotine is that way bad. It will cause more and more addiction. Nicotine will cause addiction. Patient will consume more. Patient will consume. Why patient? उसको तो कोई symptom नहीं है. Why is called patient? Those who are addicted are psychologically disturbed, I would say. So even though the person does not have BP, diabetes, does not have any other problems, but he is addicted. He has this problem, psychological dependence on the nicotine, and hence he is called patient. So he is going to smoke, he is going to use e-cigarettes. अब problem क्या आ रही है? E-cigarettes, people will go progress. आप लोग जाते हो ना फर्स्ट स्टैंडर्ड से 10th स्टैंडर्ड. Similarly, you will progress from E6 to a smoking, to a tobacco in its pure form. So, is ENDS a boon or a bane? It is a boon for those who want to cease tobacco for a limited period of time. As per the data, it has not been found to be effective, but it is used by those जिनको cigarettes या जिनको तंबाकू छोड़ना है, but they don't know that it is equally harmful. So is it a boon? No. Is it a bane? Yes. Now what are the generations of e-cigarettes available? You see, first generation, which is almost like a cigarette. Okay, this is for people who want to leave cigarette, they want to try They want to simulate that this is a cigarette. Second is the second generation where they have a canister build-up. Third is where the problem starts. Third and fourth. Why? What problems? Not only is it with lot of amount of nicotine, it is refillable. It is also you can adjust the settings, meaning you can adjust the watts. यानी कितना heat करना है. You can adjust the air coil, so you can manipulate with the settings, and you can get more and more nicotine. So third and fourth generation तो हद्दी हो गई. भाई तुम और भरो. It is not disposable. It is reusable, readjustable, and you can use more and more refillable. So that's how people have progressed from first generation to fourth generation. Agreed? Acha. Now, I don't know, does anyone around you use an e-cigarette? कोई देखा नहीं है? देखा है? कहाँ देखा? अच्छा, who uses? Okay. So, क्या, when you go very close to them, what do you feel? Can you come near, madam? I can't hear. Come.
So actually, as you mentioned earlier, there are a lot of flavors that come with these cigarettes. So whenever I go near them, it's certain sort of smell that comes.
Very good. So you get a fruit flavor or a menthol flavor.
Yeah, something like that.
Does anyone use shisha?
I have seen people use
So
it.
shisha and hookah are banned. Okay. But people are using shisha and hookah, which again have a nicotine. And the bad part is, these canisters, you will add nicotine, but you will also add other things. Okay. Like any drugs you can add to it. You can add marijuana. You can add cocaine. You can add other drugs which will make you addict. So not only that people started, so this ENDS started getting banned. It started getting banned. People started putting some more drugs. It is marijuana, it is cocaine, etc., etc. So that was a flip point of using ENDS. So Government of India is trying to ban ENDS. It has banned ENDS, but it is not fully in. Okay? If you see FDA from America, so they are banning ENDS, but yet 13 to 14 brands of ENDS are still very much active. They are still very much active. Have they confessed to you that they do e-cigarettes vaping?
They do it in front of.
They actually do it in front of me, but I'm uncomfortable, so I just leave sometimes.
Okay, great. Do they? What are the ages?
The ages approximate are from 18 to 23, 24.
Right. So ENDS was widely taken up by adolescents. It was taken up by the youngsters. Big time. It was not taken up well by the older guys. But have a seat. But if you see that these guys, they progress to taking cigarettes. They start using tobacco flavors. They start utilizing that, and those have got a long-term repercussions. Shall we start a small quiz? Yes, I don't know, I've just made some 3-4 slides. First slide. First slide. एकदम पहले. हाँ. Okay, एकदम पहले. Okay, now. First. Some e-cigarettes are safe for youth. True or false? False. सबने बोल दिया. क्या करने का? हाथ रेस करके बात करो ना. Okay, so it is false. Next slide. Yeah. Next. Okay, next. Okay, next. Okay, wait. So they come in different shapes and sizes. They will light up a liquid into aerosol that user inhales. Aerosol is a suspension. Suspension है, which is made of solid or liquid particles. The solid particles are what? They are chemicals like lead, chromium, which are present in your E6. Okay. So not only you are at the risk of taking nicotine-induced nitrosamines, but also your heavy metals that are present in the liquid, which will also be a carcinogenic, which is cancer causing. Not only it will also cause lead poisoning, chromium poisonings in a large dose. Next. Okay. So e-cigarettes create a harmless water vapor. Is it? Sir, आप ही बताओ किसको, क्योंकि ये सबको आता है. किसको पूछे आपको? बोलिए. False. Why? I spoke so much and then we are conducting a quiz. So you know the answer. जो आता है बोलो. I think I gave the answer in my talk. बोलो. Pardon? It's true. Hariom. So basically, जो smoke आती है ना, जो water vapor आती है, जो vaping होती है ना, it consists of nicotine and all. So the water vapor which is produced is not safe. You are going to inhale that, right? In a slow dose over a long period of time, causing cancer. So it is not. So her answer is right, but justification नहीं है. This is justification. Next. Okay. So just a sec before we go on to this. So aerosol will not only consist of heavy metals like nickel, tin, lead, cancer-causing chemicals, volatile organic compounds, ultrafine. It will also have a polycyclic aromatic hydrocarbons. This is something which is chemistry, but those are equally bad. Next. Okay, most e-cigarettes contain nicotine. Please, madam, what's your name? नहीं, Manasvi, बोलिए. True. Okay. Now, we go ahead further. Okay, so we have dealt with 4 topics. What are e-cigarettes? What are the health risks? What leads to e-cigarette use? The 4th we have not covered, which is what can you do about it? So what can we do about this? How can we stop people from taking e-cigarettes? Anyone who can give the answer? Any imagination? Please, tell me.
By awareness campaign.
Perfect, man. So we are creating an awareness campaign here. It's like a group counseling. It's like a group discussion. Absolutely. What's your name? Perfect, madam. So creating health awareness. But what can you do at school level? What can you do at school? We are in school. We are in our MBA school. We are in our medical school. We are in engineering school. Okay. So what can we do at a school level? So awareness campaign. That is one thing. Making people. Yeah. Please tell me.
Some activities which make their mind to be active.
Right? So challenging them, challenging the thought process that e-cigarette is not good. So what activity would you like to do? Please tell.
So street play.
Street plays. Very good. What kind of street plays would you like to do?
So we can show that what addiction causes, like how family transforms after addiction.
So street play in the school?
Yes, sir, outside at street also and
For other people or for the school?
yes.
For other people or for the school?
For both, sir. Everyone.
So plays in your festivals.
Yes.
Okay. So play in your festival that you can do. So awareness campaigns, play in the hospital. Try and make vigilant groups. Do not catch hold of them. Do not victimize them. Okay. But you can have the counseling sessions for those who want to quit and those who come forward that they want to. Guys, sit down. Those who want to quit smoking. Make them aware of this. Okay. Any other thing that we can do? So something like research-based programs are there which are available, which you can practice in your colleges. Okay. Next slide. So in general, nicotine, it's a colorless, oily, water-stable, highly toxic agent found in tobacco and nicotine. Next. Okay, it's more of a alkaline base than an acidic base, which makes it very easy to absorb into the blood. Next. Okay. Does nicotine harm brain development? बाजू में आपका नाम
Lakshmi, it is Lakshmi Shah.
Yeah, so how does it affect brain development? True or false? Acha, sorry, I give the answer, but why? How does it affect the development, brain development? Please, ma'am. You want to answer? You want to answer that? If not, then I'll ask her. Ask her. You don't want to answer. Try something. Yeah.
As our brain is still developing, so if we, it is not fully developed.
So how does it affect?
So it affects, we start stressing.
So I told you, cognitive abilities, memory, learning, everything goes down. Great. Next. Next. Okay. Attention, learning, mood, impulse control. Next. Next, please. So not only nicotine affects us, it also causes poisoning, affect pets also. So what is second-hand smoke? What is third-hand smoke? First-hand smoke is what you smoke. So what is second-hand smoke and what is third-hand smoke? Harmful? Rohit, no?
जो सामने smoke करते हैं वो अपने inhale करते सामने वाला
हाँ.
को
So that is what, second or third-hand smoke? What is third-hand smoke? Good, right. So second-hand smoke is who gets affected if you smoke? Your friends, your wife, you. So who's smoking around you?
जो smoke करता है उसको ज़्यादा इफेक्ट नहीं होता जो सामने बैठा है
नहीं, उसको तो होता ही है. लेकिन second-hand smoke वाले को जो लेता है, he is also equally at high risk. So second-hand smoke affects whom? Your people whom you love, your dear ones around, your family, your brother, your sister, your wife. Wife नहीं है. Okay. So your friends around, you're smoking around. The smoke goes on the face. Okay, that you're going to inhale, and that is going to cause lung affection. It causes lung injury. It causes lung injury. It's called AVLI. Okay. Okay. Then what is third-hand smoke? What is third-hand smoke? So you have smoked, the fumes have gone in the air, and now they are deposited on the couch, on your pen, on your table, and that goes into that you inhale. So third-hand smoke affects mainly the babies around, babies, newborns, because the father is smoking, it's going into the air, or someone who is your brother who is younger to you by 10-15 years. They will keep on getting ear infections, nose infections, throat infections because they are constantly inhaling the dust consisting of nicotine, cancer, which is settled on the floor, on the toys, on the pen, on the things around. You know? So that's a third-hand smoke. So it affects pets, it affects almost everyone. Next. Yeah. Go ahead, next. This is more technical. Next. So this is more about how is cigarette getting marketed. Okay. So you have at retail stores. So the most important thing at school level is that the tobacco or the e-cigarettes in any form has to be banned in and around that area. You have to put the billboards. No smoking, no ENDS, no use of anything. That keeps on motivating everyone. Smoking is injurious to the health. Chewing tobacco is injurious to health. Taking e-cigarettes is injurious to health. So you have to keep the billboards around. So make a tobacco-free environment. Health awareness campaigns, tobacco-free, put billboards. Okay. There are volunteers which you can have who can start, wearing t-shirts. And going around in your committees, festivals, the shirts that you are wearing should have no tobacco, say no to tobacco symbols all around. This is we want to create awareness at a huge level. So, yeah.
Doctor, on behalf of all the students, I am asking this question.
Yes.
Agree e-cigarettes are bad, equally bad, and all forms of nicotine are worst.
Yes.
But the problem is that those students who are addicted,
Yes.
and जब वो तलब आएगी, when you feel like, they know it's bad, but they are not able to stop themselves. So what they should do in that case, कि तलब आ गई, घर पे कोई नहीं है, या तो फिर एक ऐसी जगह मिल गई जहाँ पे वो कर सकते हैं, मन के, हम बोलते हैं ना, they are the slaves of their mind, नहीं रोक सकते अपने मन को, नहीं काबू कर सकते, कर लिया, स्मोक कर लिया. So how to stop that?
Okay. Shall I answer this question? So, I am the right person because I am a certified tobacco cessation specialist. Now, the first and most important thing in this tobacco cessation or the cessation of e-cigarettes is the commitment. Okay, it's not the willpower. It is the commitment that I am going to stop tobacco. I am going to stop taking cigarettes. So there are going to be two group of people. One who are not able to stop craving and don't want to stop taking cigarettes. And there is another group who are having craving, and if they try to stop, they get withdrawal. So there are two groups. First group who has no commitment, no willpower, nothing they don't want to stop, we cannot help them. But those who are getting craving, but they want to stop, they realize the importance, benefits of smoking. The first and foremost thing is they have to reach out to 3 to 4 people around. The first is they have to reach out to a tobacco cessation specialist. Now the kind of group that we are catering today to is quite mature, 18-24. If they want the help, first approach a certified tobacco cessation specialist. Now how many are there in Mumbai? You don't know. So then what to do? So you have, first and foremost, go online. Everyone goes and uses internet. Yes. So go on to the self-help groups. Say no to tobacco. Just put it down and get a lot of material. You will get ways to stop tobacco. You will get ways to deal with craving. The center point or the cornerstone of tobacco cessation is behavioral counseling. What is behavioral counseling? Suppose a person is taking tobacco and he wakes up at 6 a.m. in the morning. 6 बजे उठ जाता है and 6:30 में I want to have a first smoke. Okay, I go to washroom. But I cannot, मेरा पेट खाली नहीं हो रहा है unless until I am smoking or I am taking tobacco. So these are the people who are highly addicted. Second is I have tea and coffee and I want to smoke, or after meal I want to smoke. So there are these behavioral habits. Now those who are addicted, if they don't, they will develop craving, they will develop withdrawal. We need to get solutions. That particular individual is smoking at what time and how do we get the solutions to those. Suppose he likes to smoke after tea or coffee, change the brand of tea, change the brand of coffee. Or I am riding on a bike and I am going through the pan shop which is giving tobacco. I will change the route of my area. I will avoid friends. I will tell, look friends, I want to quit tobacco. I want to quit tobacco and I will, please help me out. You smoke, you take tobacco if you want to, but please do not force me. So you have to avoid friends for a few days. So the behavioral therapy, behavioral counseling, this is not psychological counseling, this is not psychiatry area. कोई थप्पा नहीं है, कोई there is no, what we say is a taboo. But meet a tobacco specialist or read online. There are self-help books which are available. If you don't want to go out publicly that look, I was taking tobacco, and it's a taboo, it's a stigma of the society. I'm getting stigmatized. Okay, I get patients who are a cancer patient. So thank you so much. So I have a patient who say that please do not write tobacco on the paper. I'm a case of a cancer. I see you are a cancer survivor, you have been treated, you are doing well, but we don't want people to know that I have undergone a surgery for my oral cavity because I was tobacco. I said, don't say tobacco. But there is no point in feeling stigmatized. You are at a level where we can prevent you from developing into a cancer. Please go to self-help groups. Keep on reading. There are group counseling sessions. There are people who are conducting in a room, or 50 people who will come and you will listen to the counselor. Try and work on that. So the commitment is most important, not the willpower and the environment. Change the environment, and have a commitment. You would be able to seize your tobacco. Now, how to stop craving? मैंने टोबैको छोड़ा, आज से मुझे टोबैको छोड़ना है, लेकिन मुझे क्रेविंग बड़ी हो रही है, मुझे लेना है, नहीं तो मुझे बस I'm getting anxious, I'm getting restless, I'm not able to, my bowel habits have gone, I'm not able to sleep, insomnia, मुझे नींद नहीं आ रही है, restless हो गया हूँ मैं चिड़चिड़ा हो गया हूँ. So in that situation, what we do is, a therapist will give you a pharmacotherapy. यानी क्या करते हैं हम? We give a nicotine patch, high dose का लगा देते हैं ऊपर on the back, जिसमें से धीरे-धीरे nicotine goes into the blood. So now the difference is you have not taken tobacco, you are taking nicotine, and you give chewing gums. Nicotine chewing gums every 2 hourly. So that maintains your blood level of nicotine. एक बार आपने तंबाकू छोड़ा, which we do it within 14 days, जो cessation करते हैं, that total cessation of smoke or chewing tobacco is 14 days. But ये जो फार्माकोथेरेपी दे रहे हैं tobacco का निकोटीन जो दे रहे हैं, that will be tapered over 3 months. धीरे-धीरे करके आज हम 2 घंटे में एक chewing gum खा रहे हैं ना, तो over next 2 weeks, 3 weeks, 4 weeks, I will make it instead of 10 to 12 popping tablets of chewing gum or nicotine chewing gums, I will reduce to 6 to 4 to 2 to 1. I will, जो patch I'm using nicotine patch for a slow release of tobacco nicotine into the blood. If it is 21 milligrams, we'll give it to 14, we'll make it 7. So we'll taper off the nicotine that the body requires. Slowly body will come back to normal. And the total period required is 3 months. But cessation of tobacco total is only 2 weeks. No matter how much the tobacco someone is taking. Someone is smoking 5 packets a day, or someone who is taking say 10 to 15 pudis of gutka, mawa and all. So yes, those who want to get help, does get help. There is a help available online, in person, everywhere, where you will be taken care of your withdrawals, of your cravings.
So sir, Nicotex tablet do help?
We do is, we give a nicotine patch. Nicotine patch causes slow release of nicotine into the blood. And to maintain those nicotine levels which the patient was having, we put a nicotine chewing gums. It is never used alone. It is always used in a combination of nicotine patch with nicotine chewing gums. That has a deadly response. Patient leaves tobacco, भूल जाता है कि tobacco क्या था. Okay, so it is never, because people will keep on taking only nicotine chewing gums. It never helps. Because moment you take, you feel good, and moment the level goes down, you feel bad. So you want at that time a constant flow of nicotine, which a patch, a dermal patch, a skin patch that you apply on the body, it will start releasing the nicotine in slow form. So that's how it is. Always a combo of pharmacotherapy with behavioral counseling. But I would still say the cornerstone of treatment is behavioral therapy. It is not pharmacotherapy. Cravings will happen for 2 to 3 weeks. Craving stays only for 5 minutes. Moment you have gone through 5 minutes, there are 5 to 6 ways how to deal with that craving which stays for 5 minutes. Once you are done, over that 5 minutes, आप भूल जाते हो. मुझे वड़ा पाव खाना है, बड़ा craving हो रहा है. यार दिख रहा है मुझे वड़ा पाव, लेकिन यार मेरा वजन बढ़ रहा है, मुझे वड़ा पाव नहीं खाना है. तो I start telling myself मुझे नहीं खाना है. I resort to my mobile and I start watching some गाना, or I see some comic shots, कपिल शर्मा एंड ऑल, मेरे वो 5 मिनट चले गए ना, मेरा क्रेविंग चले जाता है. So one of the technique of dealing with the craving is to divert your attention. It is what we call as the principle of 7 Ds or 5 Ds. So divert, drugs, that is your medicines, drink water. So that is one. Deep breathing, okay, so forth. So on and so forth. So there are ways to deal with this craving. There are ways to deal with craving. What kind of diet? There is a specific diet that you can have when you are undergoing a withdrawal. Stay back at home for 7 days, fight through your withdrawals, use all these methods, and you will be successful in overcoming this habit of tobacco. So that's how. So I do practice this. I do tell for my patients. I do have my wellness clinic as well at Mahim and at Baikalla, where I do conduct this kind of sessions for the people who are committed to leave tobacco. For those who are just coming to listen to me, and those who are not committed, I do take sessions, I do make them aware about the health benefits of living tobacco, but I don't force them, because you cannot force anyone unless until he's committed. You cannot help. So if someone wants to get a help, will be given help. Someone doesn't want to have help, they would eventually when they realize the importance of quitting tobacco. So this is how we go about. So next slide. I think that answers the question. So okay, the tobacco can sell any type of flavor of e-cigarette they wish? Yes or no?
Yes, sir.
Yeah, so they do. Next. False. FDA approves, so we are wrong. So I'll tell you what happens is that various companies come with various flavors of cigarette, of e-cigs, and they have to go through FDA before the marketing starts. So 35 to 40 products have been launched, out of which FDA has only approved 13. So it's a false answer. Next. Okay. Next. Next. Yeah, help your school go tobacco free. Next. This is for you all. Next, please. Next. So is it worth it? So we have free quitting. So one of the things is those who don't want to reveal themselves that they have been taking tobacco, but they want to. We have tobacco quit lines. We have tobacco quit lines that are phone numbers. There are certain lines on which you call and you will be counseled. You will be given the the education about how to stop tobacco. Next. Again. So ENDS is vaping, juuling. So wherever you come across, it is nothing but e-cigs. That's okay. That's okay. So जो last जो section है ना, that deals with how the school should go about, which we have discussed in some details. Any questions from you all?
So,
Yes.
सर कहते मतलब मेरे बहुत सारे फ्रेंड थे स्कूल में जो सिगरेट को कंज्यूम करते थे, और उनके अंदर एक मिथ था कि सिगरेट स्मोकिंग करने के बाद तुलसी का पत्ता खाते और करते उससे उनको कुछ नहीं होता. और सर टीवी पे एक एडवर्टाइजमेंट आता है निकोटेक्स करके, तो सर क्या आप बता सकते हो कि उसको अगर एडिक्टेड है तो उसको यूज़ करता है तो क्या उससे मतलब सर लत छूटती है क्या सिगरेट पीने?
तो मैंने अभी वही बोला कि आप जो बोलते हो ना, पहले तो आई कम ऑन टू निकोटेक्स, देन आई कम ऑन टू तुलसी का पत्ता. ओके. सो निकोटेक्स का मैंने यही बोला कि what are we giving is a nicotine replacement therapy. It is called NRT. जिसमें बोला कि we add patch with nicotine chewing gum. सिर्फ patch या सिर्फ chewing gum नहीं देते हैं, तो only one thing will not help. बट ये जो NRT है, nicotine replacement therapy, उसको मैं जोड़ देता हूँ आगे S stands for supervised nicotine replacement therapy. So if you go to a right consultant or right person who will supervise your nicotine in your blood or the way you give, it will be effective. So nicotine alone will not help. Patch, nicotine chewing gum will not help. Nicotex जो बोल रहे हैं आप, it has to be combination. कौन सी मात्रा में? is dependent on the level of addiction that someone has. Second, तुलसी. So पुराने ज़माने में क्या होता था कि आजकल अच्छा फर्स्ट क्वेश्चन ये टोबैको इज अवेलेबल इन व्हाट फॉर्म्स? क्या क्या ब्रांड नेम कौन से हैं? किसी को आइडिया?
सर
आती छाप,
फोर स्क्वायर.
हाँ,
फोर स्क्वायर.
फोर स्क्वायर. So what are this? These are to be very precise, पान मसाला, गुटखा. ओके, पहले क्या करते थे लोग? ये होता ना बीटल लीफ यानी पान में चूना लगाना, स्लेक लाइन, उसमें बीटल नट ऐड करना, सुपारी और उसके साथ तंबाकू. सो द अमाउंट ऑफ तंबाकू जो जाता था पेट में वो काफ़ी कम था. एंड तंबाकू के जो साइड इफेक्ट्स है टू सर्टन एक्सटेंट, नॉट टू होल एक्सटेंट, वे आर गेटिंग निगेटेड बाय द पान कंसिस्ट ऑफ क्लोरोफिल. ओके, आज ऐसा वहम पड़ गया है कि मैं तुलसी खाऊंगा तो मेरा ये होगा, लेकिन तुलसी की कितनी मात्रा खाऊंगा तो ये नेगेट होगा, ये किसी को नहीं पता, ना आपको पता ना मुझे पता. सो इट इज नॉट गोइंग टू बी सेफ. इनिशियली द अमाउंट ऑफ क्या बोलते हैं माउथ कैंसर जो होता था बिकॉज ऑफ टोबैको चूइंग वाज लेस, बिकॉज आदतें बड़ी अच्छी थी. लोग 80 साल तक खाते थे बिकॉज मोर ऑफ लीफ, लेस ऑफ टोबैको. आज गुटखा पान मसाला में इट्स अ प्योरेस्ट फॉर्म ऑफ टोबैको दैट यू गेट. सो यू आर गेटिंग एक्सपोज टू लॉट एंड लॉट्स. नाउ उसमें हम कितने पान के पत्ते खाएं, गॉड नोस. तो वी डोंट नो आंसर टू दिस. सो दैट्स व्हाई इट इज नॉट रिकमेंडेड कि खाओ और हम ये भी खाएंगे, बराबर. सो इट्स अ मिथ. नाउ यू कैन ब्रेक इट टुडे टू देम कि भाई ना खाना, इसकी कितनी मात्रा नहीं पता, किसी को नहीं पता. एनी अदर क्वेश्चन? यस, आई थिंक देयर आर टू पीपल. टेल मी क्विकली. मैडम, देन यू. ओके.
Sir, I have one situation, as in you said कि government ने सिर्फ 13 products को allow किया. So I stay at Malad, sir. So near to police station, we have many shops selling hookah pots and pen hookah, which you showed first generation. So sir, there we have a lot of options of flavors like double apple. Then this. So how we can stop that shops?
So thing is, from government point of view, you increase taxation. You make it so costly that it is difficult for them. Now, ये जो pods मिल रहे हैं, those are illegal pods. So ये जो बैठे हैं वो corrupt officials को corrupt और बना रहे हैं and अपना चला रहे हैं. ENDS has been banned in India. ENDS is not promoted, not marketed. Whatever is happening in Mumbai, in Maharashtra is illegal. In certain states it is still allowed. Sorry, Gujarat में allowed है to certain extent. So you get at a lesser cost. Here government is banning. Maharashtra government has banned ENDS. So whatever available cartridges, whatever you are seeing with double apple flavor, other fruit flavors, these are all illegal. But how to stop it? To make it very costly. So when I put my recommendations, there were two things which I suggested. One is increase taxation, increase the taxation on the nicotine and tobacco products, and decrease the amount or the make nicotine chewing gums, nicotine patches cheaper, make them cheaper, easy to buy. Difficult to buy tobacco, but easy to buy this kind of chewing gums. That's how it has to be. Does that solve your problem?
Yes, sir.
Next, Madam, yeah.
सर पब्लिक स्मोकिंग जो होती है वो काफी डेंजरस होती है.
Public?
पब्लिक स्मोकिंग.
Yes.
तो सर उससे कैसे बचें?
यार बैन तो किया हुआ है, लोग फिर भी कर रहे हैं. क्या करें? गवर्नमेंट अपना काम कर रहा है. It is bad. You are not supposed to smoke in a public place. You can smoke at your own house, in your home, in a closed room. So even at airports or at railway stations, you have a specific area where you can smoke. थोड़ी वो सबको बोल रहे हैं, लेकिन ये जो रास्ते पे चलते हैं, people are still smoking and no one, it is very difficult to stop that.
Sir, but there is an article, I don't know exactly the article number, but this may hota hai right to freedom to leave and let leave others.
The government of India in their constitution, whatever the legislation what they have brought about, they have recommended a punishment for 3 years. So 6 months and 2,000 rupees for the first offence, or as you go ahead it becomes 5,000 rupees. And but यार ये बहुत बड़ा कम है. Government is trying to put somewhere. Government is trying to put somewhere the this one, but it is difficult. So the idea कि अगर ये नहीं हो रहा तो और क्या करें? तो tobacco awareness, इसलिए हम खड़े हैं यहाँ पे आज कि भाई ये तो चलेगा, गवर्नमेंट अपना काम करे, हम अपना काम करेंगे. We will try and target all the audiences who are smoking, recommend them, encourage them to quit smoking. There are a lot of ways where you can encourage a person to stop smoking. So we do that way. Thank you so much. Yes.
सर अगर वो जो विमल आता है एडवर्टीजमेंट करते हैं जो सेलिब्रिटीज लोग, तो गवर्नमेंट उसको बैन क्यों नहीं करती? वो तो हार्मफुल है ना.
अच्छा, अब ऐसा है कि जो विमल जो आ रहा है ना, वो सुपारी आ रही है, तंबाकू नहीं आ रहा है.
बट उसमें जो कंज्यूम करते हैं उसमें टबैको होता है.
अभी सुनो तो मेरी बात. जो ऐड आ रही है वो तंबाकू की नहीं आ रही है. ये जो बताते ना विमल वो 3-4 हीरो के साथ, that is a flavored supari. अब can flavored supari lead to cancer? Yes, it does lead to cancer. It does not have tobacco. But supari also leads. But as of now there is no ban on supari. अब क्या करें? So these people are getting trolled on the various social media. How can they recommend that? Okay, ये पान बाहर केसरी and विमल जो आ रही है ads, they are giving suparis. The betel nut which are flavored. खाया कभी? बड़ा खराब होता है. I have tried once. It's very, you can only eat one dana. Cannot eat more than that. But in a long term, it is also equally strong enough to cause cancer. एनवायरमेंट गंदा नहीं होता है, वो बंदे का शरीर बड़ा खराब होता है क्योंकि वो स्मोक नहीं कर रहा है. तो वहाँ पे किसी और को तकलीफ नहीं है, हालांकि वो खुद खा रहा है. ही विल हैव अदर इफेक्ट्स लाइक डिक्रीज माउथ ओपनिंग. जो रक्त प्रवाह जो होता है, जो ब्लड सप्लाई जो होती है मुंह में, those go down. मीनिंग यू विल गेट लॉट ऑफ फाइब्रोसिस. मुंह खुलता नहीं है. देखा है कि नहीं ऐसे लोगों को? खुलता नहीं है, ऐसे खाते हैं. तो ये those are those people who have had tobacco, those have had a slake lime and betel nut ka deadly combination. What we call is betel quid. So yes, and that's why so Vimal, what they are doing is right but wrong. Are you getting? They are doing within the law. That's why you can see it's not taken out. It will never be taken out unless and until government bans supari. But supari बननी तो जरूरी है. This is not the only use of betel nut. There are a lot of other uses also. So government will not ban it, but marketing companies will do this, will try and utilize this. Can't help about that. But eventually again the awareness will help. Next. कुछ बाद में आके मिल मुझे. So the idea is, see, both are harmful. Okay, both are harmful. Drinking, should I say this? Drinking in certain amount is okay. What is certain amount? 90 cc per day for males and 45 cc for females. That does not mean that you drink. Drinking equally is bad. Drinking and smoking will lead to cancer quickly. Drinking will affect your family. Drinking will affect your liver. Drinking will affect a lot of things because people again get addicted to drinking. So drinking will never be banned, alcohol will never be banned. It is devil, but a lesser devil as compared to tobacco. Huh? But पीना नहीं. पीना बड़ा खराब है. Okay? Yes. Yeah. Madam, and then you again. Sure.
So I have heard that drinking certain amount is good for health.
I told you, 90 and 45.
Hello. Health feel अच्छा होता है.
कह रहा हूँ मैं 90 and 45. So it affects your heart. It makes you relax. Definitely. So that's why it is in a limit. Smoking has no limits. Yeah.
जो स्मोकिंग करते हैं
हाँ.
उन लोग को ब्लड डोनेट कर सकते हैं क्योंकि निकोटीन रहता है ना ब्लड.
कर सकते हैं.
6 hours.
निकोटिन मेटाबॉलिज्म हो जाता है. तो ऐसा बाय लाच नहीं होता है. ओके. अब कैसा होता है कि जो निकोटिन बहुत ज़्यादा ले रहा है ना, उसको अदर प्रॉब्लम्स भी आते हैं, लाइक ब्लड प्रेशर होता है, डायबिटीज होता है. इन दैट सिचुएशन हीमोग्लोबिन बहुत ज़्यादा बढ़ा हुआ होता है. So they are not able. So there are contraindications of smoking-related problems which make someone not give blood. But अगर वो 5-6 सिगरेट फूंक रहा है, he can give. Okay? जब ज़्यादा मात्रा बढ़ जाती है ना, तो it affects the body overall. So at that time, it automatically becomes a contraindication to give our blood. Yeah. So why? So alcohol is good. We need in limit. So red wine is good for the heart. Okay, white wine is also good. Everything in limit. Okay, we have to maintain that limit. If you are drinking daily, it's wrong. People do drink daily, but people forget the limit, the cap. If you forget the cap, you will go into a lot of problems. So lot of Christians around, lot of Americans, lot of Europeans, they do drink. Why do they drink? Russians do drink a lot. So why do they drink? Because of the climate. Somewhere something is helping them. Not everyone dies of the alcohol induced. But if you start crossing your limits, if you go every day more than 90 cc and whatever recommended levels of alcohol that you can take, you will have a problem. For that matter, even if you have रोज बटर खाओगे, रोज बहुत ही ज़्यादा हम खाते हैं, ओबेसिटी हो जाती है, वो प्रॉब्लम ही है ना. तो आज कह रहे हैं कि खाना हम वेज खा रहे हैं, हम वीगन है, बट फिर भी मुझे हो गया ब्लड प्रेशर. तो ऐसे तो नमक, सो एवरीथिंग इन लिमिट इज ओके. प्रॉब्लम इज विद निकोटिन एंड ऑल. सो निकोटिन का हिस्ट्री है. निकोटिन कैसे आया, कौन लेके आया इंडिया में, जानना है? So nicotine first came from Portuguese. Portuguese guys, they landed up at the shores of India. It went to Vijayanagar. You know Vijayanagar? Yes. Vijayanagar से it went to Delhi. Delhi में it was used by Mughal emperors and only by aristocratic family. So this happened in 16th century. Till 16th century there was no tobacco in India. 16th century में it went to Mughals and it was a status symbol, you know, of prosperity. Only the rich will have. But ऐसा होता ना, ये है तो मैं क्यों नहीं, मैं ये क्यों नहीं. तो बस it started trickling into the people, and from there it went to whole of India. So Britishers were not the ones to get, it was Portuguese who got to South India, south of India to North India, and now whole of India. Okay, and then we started exporting also. So वो नौबत आ गई कि we started mastering the game. Because tobacco would give you a lot of revenue, a rich revenue. So that's how it started. So, and that was also, it happened in the court of Akbar. No other Mughal ruler, Akbar. Because Akbar was welcoming everyone. So that's how it started.
Sir, I need to ask something
Yeah.
based on something that has happened with me previously.
Yes.
So actually, whenever you try to stop your friends from doing something that is harmful and toxic for your health, actually, that what they say is that people keep eating junk all the time. That is more harmful than smoking or doing e-cigarettes, for example.
So you tell them.
How do you tackle that?
So you tell them that everything in excess is poison. You will not be able to control yourself when you persist with e-cigs or with the cigarettes. And even if they are not ready to understand, do not be nagging. Do not get nagging. Do not victimize them. Just leave it to them. Let them understand their own ways. You try your all, but do not be nagging. Do not stop talking to them. No. It's all about not sympathizing, but giving empathy. You know what is empathy? So give empathy. Do not sympathize with them. They'll feel victimized. Do not do witch hunting. That ये देखो cigarette फूकता है. Okay?
Makes sense. Thank you.
It is always like that. So commitment plays an important role.
Sir, I have a doubt. In case if a person used to consume cigarette and later on he leaves that, but in long term, does it affect his or her body?
So I'll tell you a brief statistics. If you stop taking tobacco in any form, within 8 hours, your blood pressure will come back to normal. Within 3 days, your sugar will come back to normal. Within 5 years, the risk of getting stroke, paralysis will come down to normal. Every year, the chance of getting cancer will come down to less than 1%. So if you are at 15% risk, you will have 14% risk, then you have 13% risk, then you have 12% risk. So quitting tobacco is going to lead to a lot of health benefits, and the benefit starts almost immediately within 6 to 8 hours. So yes, it is very beneficial. You may not be able to stop cancer if he has to have, but that cancer, instead of happening at 5 years or 10 years, it will come at 15 years.
So one more doubt I have. If a woman is consuming cigarettes, then later at the time of pregnancy, thus it will affect the child.
So there are two things. If the woman is pregnant and if she is continuing with the tobacco, the pregnancy is in 3 phases. First trimester, second trimester, third trimester. If you have in first trimester, if the lady is smoking, you'll have high chance of stillbirths, dead babies coming out. You have a high chance of growth retardation. बच्चों है ना छोटे साइज का born होगा. You have a chance of intrauterine, पेट में ही बच्चा मर जाए. So stillbirth, IUFTs, IUGRs, there is a high chance that patient, जो बच्चा है वो विकलांग आ जाए with anomalies. Okay? Problem क्या होती है? When you are taking a smoke, the nicotine in the blood goes from mother to the child. It doesn't stay back only to mother, it goes to child also. And child will have these problems. So they will have, when they are born, they will have a lot of problems with their lungs. They are not strong enough. They will have regular, repeated infections. So premature birth हो जाते हैं. If due date है within 8 months, 9 months, the mother will deliver a baby at 7 months. So small बच्चा आ जाएगा. Okay, बच्चा critical हो जाता है. बच्चा has to be kept in the ICU, pediatric ICU for 3 weeks, 4 weeks, 1.5 months. So a lot of problems. And I get very happy when a woman is smoking, because the best time to stop her smoking is during pregnancy. So she is very much motivated that I want to save my बच्चा. बड़ा मजा आता है मुझे इसको बताने का, क्योंकि मेरा सक्सेस रेट बढ़ जाता है. My success rate of making her stop tobacco smoking goes 10-fold higher. So मैं फायदा जरूर उठाता हूँ ये situations का to stop tobacco.
That's it, sir. Thank you.
Pleasure. Thank you. Done? Or your? We can discuss on and on. Thank you. Sir, with your hands, at your hand, we need to give it to someone, certain things which I've got. For those who have answered, I think you know the names better. Rohit, which I can pinpoint. But there were here also 2-3 girls who spoke well. There was this lady who was sitting at the back. कितने लेके आए हो? 3 लेके आए. The 3 best. But I think sir is in a better position to identify who has answered.
I'm announcing the result. Dr. Sir has already spoken that he will going to quiz you all, and those who will going to give the maximum answers, he will going to give some token of appreciation, gift you can say, from his side to those students. So first is Rohit, please come in. I think everyone knows who is ranked one.
NSS clap goes on.
Second is Aishwarya. Congratulations. By the way, she is my student.
NSS clap goes on. Jai Hind.
And third is Bashir from NSS. And I would also like to congratulate Shalu Yadav from NCC. Congratulations, Shalu. Please stand up. Congratulations. And Shriya Hegde from NCC. Shriya. Where is Shriya?
Hello.
Please come in. Please come in. Come in.
You all are such a wonderful audience, and I didn't expect, so I didn't get more. I'm sorry. But I think this is a very good batch of yours. Interactive, they want to understand, know. So, all the best to both of you girls. Thank you so much. Pleasure. Do well. Thank you so much. But if you all are interested in a fight against tobacco, I would say that you can approach, we can form a tobacco volunteers. Me doing alone is not going to be helpful. I want people to come, I want people to join in the fight against tobacco, because this is not the battle of one person. I can only come today at one place, but there are many other places where people are taking tobacco, where there are many places where people need to know that it is tobacco. So I can't do it alone. If I have a big team, it will reach out to many, not just in Mumbai, in Maharashtra, and even beyond that. So if you are interested, let me know. I think number rahega na? Let me know. Let me know about that. If you, those who are interested in fighting out, let's fight together. Can't fight alone. Thank you.
Thank you, Doctor. Congratulations, Shalu and Shriya.
Now we are at the end of the program. Now, as you know that my name is Professor Dr. Anil Dindime, and I am the convener of the Green Initiative Committee It is my honor and privilege to give a vote of thanks to all those who helped make this assembly happen. Thank you very much, Dr. Snehal Shah sir, for knowledgeable, informative and motivational presentation. I would like to thank Dr. Snehal Shah sir for taking the time to prepare and deliver the speech. It was clear that you put a lot of thought and preparation into your talk, and it showed. I was particularly interested in impacts of e-cigarettes, but I got very much extra knowledge. Your insights were valuable and thought-provoking. I am sure everyone here learned a lot of from you. Thank you again for sharing your knowledge and expertise with us. I also grateful and thanks to Principal Dr. Ashok Desai sir, my colleagues Dr. Seema Agarwal, Vice Principal, Dr. Rupa Shah, Professor Gurunathan Pillai, Vice Principal, Dr. Mittal Shah, Professor Lipi Mukherjee, Coordinator Self-Finance Courses, Professor Rajkumar Jaiswal, Professor Lieutenant Priti Jha and student. I would like to thank the teachers for taking time away from their curriculum to allow students to hear this message. This assembly would be impossible without your support. I once again extend a really hearty vote of thanks to our chief guest Dr. Snehal Shah sir, who spared time from his busiest schedule to grace the occasion. Today we had an opportunity to hear your thoughts, and this will surely be going to encourage us in our future events. I also extend my gratitude to Sri Ganeshji, IT expert, and SK Sound System. I would like to end my thanking all of you one last time. Thank you very much.
Wait one second before you leave. I just want 1 minute of yours. Shalu and Shreya, please come on the stage. There is a gift for you, please. From Dr. Snehal Shah. Please. You equally deserve it. Please. Thank you.
Good evening. I am from the. I'm sorry, audience. Actually, we thought only one or two people will be participating in the session. That's our mistake. But going forward, these two girls will get the due gift in the evening time. Sorry for the inconvenience.
Paka.